Only 2 years ago, Tasmanians watched a newly appointed Premier promise to lead a government of compassion, with a focus on health, housing and climate change. Peter Gutwein unexpectedly resigned on Monday. His job as Premier was made more difficult by circumstances outside of his control, including a global pandemic. But by leaving early, many of his pledges remain unfulfilled. At his first press conference as Premier, Jeremy Rockliff acknowledged the big job ahead. M to mute, left and right arrows to seek, up and down arrows for volume. Watch 53 seconds 53's Jeremy Rockliff speaks, after being announced as new Tasmanian Premier. His stated philosophical approach differed somewhat from his predecessor. He would lead a government with integrity, he said, and one that was courageous, accountable and delivered on its commitments. It was a nod perhaps to recent scandals in the cabinet, with 3 resignations since February, and signalled a potential shift towards a more transparent administration. Mr. Rockliff's promise to deliver will provide hope to many, not least victim survivors wanting surety that recommendations from the Commission of Inquiry into Child Sex Abuse will actually be acted upon, and Aboriginal Tasmanians working towards a treaty. And there's still a swathe of big commitments from premiers past yet to be enacted, such as reform to local government and electoral laws. Mr. Rockliff will remain Health Minister while running the state. While Mr. Rockliff may be Tasmania's 3rd Premier in as many years, it is also the Liberals' 3rd term of government. It goes without saying he has been Deputy Premier since 2014. His renewed commitment to address long-standing issues in health, housing and education is no doubt welcome news to the many Tasmanians reliant on these services, as it was no doubt welcomed when made by Mr. Gutwein's predecessor Will Hodgman, and of course, Mr. Gutwein himself. Unemployment is down and the economy in relative good health, but the population and its needs have changed. The fact remains that Tasmanians are waiting longer to get into public housing and access elective surgery. And although Mr. Rockliff oversaw important reforms to the system while minister, educational outcomes are yet to substantially improve. Mr. Rockliff will take the extraordinary step of remaining Health Minister while running the state, which he said showed how seriously he felt about the portfolio. He said he was open to reform and innovation. Once the dust settles, and he sets up his desk on the top floor of the executive building, his biggest task will be to deliver.